Sharkbait today. Quarter horse mare. I adjust her fairly regularly, every 8 to 12 weeks or so. And her owners are telling me that she's tight in her hind end. So it's about that time for her anyway. So coming out here to adjust her, see how she's moving in her back and pelvis. And I'll check her neck and legs as well. But primary complaint is that she's tight in her hind end. So regardless of the chief complaint that the owners have, I always check the entire horse because they compensate so well. You really never know where the primary cause of the problem is, unless there's an injury or there's a lameness or something like that. So from a chiropractic perspective, I'm going to check everything, make sure she's not compensating back here, and that's the reason for the tightness. Want to make sure she's not sore anywhere. And if there's a pain issue going on, then I'd refer that to her veterinarian. But I'm just going to check her movement, check her reflexes. There we go. And she actually is a little tight back here, but she's nice and responsive, not pinning her ears with those pressure points. Let's see. I can immediately see that she's tight in her mid back because she's got some spasming of her paraspinal muscles right through here. And when she initiates that pelvic motion with the reflexes, she's lifting through the SI joints and lifting through the low back. But through here, she just stays really tight and then wants to walk forward and get away from that movement. So I'm going to work on this here with some flexion reflexes, do some mobilization. And that's just moving the joint throughout its full range of motion, seeing if there's any restrictions there. And then, of course, if there's any restrictions, I'm going to adjust it. And it also looks like she's ready for some new shoes. But these guys are really good about taking awesome care of their horses. Of course, they're having her adjusted, so they must be, right? Good girl. So you can see like that little bit of pressure I put on her right side of her pelvis. She just wants to walk out of that. So I'm going to use a little bit lighter pressure and see if I can get her to lean into that stretch, which she's doing already. I'm not sure if you guys can see that. But as soon as I apply pressure to her right SI joint, look at her dropping her head. She's leaning into that stretch. That's what I want to see. I want to see that little bit of help. You know, when they give you help and they're stretching into something like this, right there, that's where you got to adjust it. Oh, is that scary, girl? So that was a big release in her right SI joint. Girl, I'm gonna let her have that for a minute. So a lot of times when you have to adjust the joint, right? Obviously, animals can't tell you where they need it, but their body language does. So if they're leaning into your pressure, that's them saying that feels good, right? That feels good. Keep pushing there. And they can't get their joints to release on their own, although you will hear, like when horses stretch their necks around and they're bucking and running, you will hear pops and clicks like that. But in order to get an adjustment, you have to be specific. Otherwise, you're just manipulating. So when they're running around and shaking their heads, you hear pops. Yeah, things are releasing, things are popping, but that's not the joints that are stuck, right? The joints that are stuck are the ones that they can't get loose, which is why they remain tight and sore and they don't move properly. So when I'm pushing on a joint and they start leaning into me, that's them going, oh yeah, that's it. That feels good, right? And that's where I'm going to adjust. If I push into a joint and they're pushing away and throwing their head up and acting like it hurts, that's not most likely where I'm going to be adjusting. Sometimes the joints that need to be adjusted are sore, so they might get a little bit of they might give you a little bit of a pain response. But if it's a big pain response or their body language just saying, no, that's not where I need to adjust. For horses, where they lean into it and where your hand kind of sinks into that joint space, that's where you need to do the adjustment. So I loved seeing her leaning into me like that and accepting that pressure and even helping me stretch that joint by leaning into it. And we got a huge release in that SI joint. So that's perfect. Now, when I have an SI joint that's rotated or fixated in extension like hers just was, then I'm usually going to have an issue in the wither, where the wither is stuck towards that side. So if I have to push that SI joint up and back like I did with hers, then what I'm going to find usually is that I have a rotation in the withers towards that side of her pelvis to the right. So I'm going to check through here, see if I get any reactions from her, and also if I can feel any restrictions in rotation up here. And then I'm going to clear that out too. And she's got it right there. Right there. And it's pretty subtle. I mean, you probably can't really tell on the camera, but she's kind of dipping into me when I'm putting a little bit of pressure there. And there's that head drop. So that's that indication I'm looking for, where it's like, oh, that pressure feels good there. She's not throwing her head up and pinning her ears and trying to get away. She's kind of saying, you know, stay right there. That's where I need the adjustment. So I'm going to adjust this area right here. And we might get another reaction from her where she kind of pulls away and gets excited. But, you know, imagine you're a horse and somebody's doing something really nice and slowly to you and it feels good. And then all of a sudden they do something really quick using a little bit of force, and you might be a little surprised. So I expect her to do that. Oh, I'm going to fix the position of the lead rope because I want this towards me so that if she panics, I can grab hold of the lead rope for my safety and obviously for hers too. So I'm going to rock her a little bit. There we go. And as soon as, ooh, there's a little release just with that pressure right there. And then, there we go. Good girl. Good girl. That's good. That's good. And then, of course, since I have to do that adjustment in rotation, I want to make sure that she can fully rotate her neck to each shoulder, make sure that that restriction in her withers isn't causing any issues up front. So I'm going to have her come around and touch my hand at her shoulder, and it might look like she's trying to bite me, but she's not. Oh, good girl. She's real sensitive at that spot, so let's see. Good girl. Good girl. Oh, good girl. There you go. Nice, easy touch. Exactly what I'm looking for. Come on. Oh, sweet pie. Good girl. Good girl. There you go. There you go. See if you can get a better view of it on this side. Oh. Come on. Awesome. So I'm going to see if she'll come around and touch on her shoulder here, just like she did on the right side. Oh. Good girl. So all I'm looking for is symmetry. I want her to be able to move to the left with the same amount that she can move to the right. Same amount of range of motion. I want to make sure she can come touch her shoulder where my finger is pushing. Oh. Obviously, you can see there's a little hesitation coming to the left. And she's a rope horse, so she gets to work to the left a lot. Oh, girl. You can imagine, if you're familiar with team roping, those horses only go left, 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 left. So if she's not willing to come over and touch, and I have issues on her left side, then she's not going to be able to perform. So really want to make sure she's clear on this side. So, there we go. There we go. Just takes a little bit of patience, a little bit of time, but that was really, really good. That was awesome. If you guys have any questions, oh, there we go. Hey, David, thanks for the question. Where did I learn all of this? Well, you got to learn it at a animal chiropractic certification program. That's where obviously you learn your fundamentals. And then once you get your animal chiropractic certification, you can go learn more specialized techniques through chiropractic seminars that are offered by other people who are certified through the same agencies that certify the schools. So I learned what I do through a guy named Jay Komarick, who has been working on horses for 40 years. Phenomenal guy. He's in Mancos, Colorado, and he actually teaches seminars a couple times a year. Highly, highly recommend, but you have to be a vet or a chiropractor to be able to attend. So first got to learn to do an adjustment. You can learn to specialize, and that's what I do with Jay. Good girl. I'm stretching her pole here. Oh, that's a good girl. That's a good girl. Yeah, and her name is Sharkbait. She's a quarter horse. Good girl. Really nice movement at her pole. Super easy and flexible there. So definitely that right SI joint was her primary issue in her spine. I'm going to check sensitivity at her pole going left and right. Make sure she can break over my pressure without any fuss. That's really nice. Flies are bad today. Whew. I'm going to have her come this way. Good, that's really nice. Doesn't take much pressure. You know, if you put a little bit of pressure, they should come right around that pressure, no problem, no fuss, no head tossing, no ear pinning, no anything like that. So that's really, really nice when they can break over at the pole. And there's a couple places you check for symmetry with gaps and whatnot, and hers feel really good. She's a little tight on this left side, so I'm going to give her a little bit of an adjustment on her pole right here, just because I feel some tension there, even though she's willing to come around. Just want to clear that out a little bit. Girl. This horse her name is Sharkbait. They call her that because she likes to bite. She's nippy. But I've never had that experience with her. She's always been super nice, super calm, really sweet mare. One of those horses that you just love to help because they seem to appreciate it and enjoy it, and they make it easy for you. She definitely is one of those horses. I'm going to check this side. Definitely ready for some new shoes. And I'm going to check her shoulder like this in the abduction. So I'm going to bring the shoulder out, bring the leg out to the side. Just checking that movement at the glenohumeral joint, which is the joint that's formed by the scapula and the humerus. Same joint that we have in our shoulders. Theirs is just a lot smaller, believe it or not. Oh, little release there too. And she's got some grinding in her knee, little crepitus, what we call that. And that's caused by scar tissue, old injuries, ligaments with some calcification. There's a bunch of reasons for it, but as long as they're comfortable moving the knee, comfortable stretching out like this, it's not really a big deal. Just something to keep an eye on, really. Sometimes people will call me because they got pops and clicks in their horse's legs when they're walking. And really, that's just kind of normal, especially on older horses. If your horse isn't sore, they're not lame, they're sound, I wouldn't worry about that. You're going to try to fix a pop and a click and cause other problems. So it's no biggie. Motion is key. If your horse is moving right, I wouldn't worry about the little pops and clicks. Come on, sweetie. Come on. Good girl. Good girl. Here we go. Awesome. Thanks for that question, David. Do you ever corporate recommend acupuncture? Yeah, I love acupuncture, actually, specifically for pain, right? It's uncommon to find acupuncturists for horses that just do regular acupuncture for wellness. They are out there, but because of the laws associated with puncturing the skin in the animal world, anytime you puncture the skin, it's considered vet medicine. So acupuncture legally can only be performed by veterinarians, which is absolute garbage in my opinion, because they're not acupuncturists, right? I mean, they are specialists in treating symptoms and using pharmacologics and all that stuff, right? They're not experts in chiropractic or in acupuncture. So I think those people should have direct access to animals as long as they're trained. Anyway, off the soapbox. But I love referring for acupuncture. It's just very, very hard to find acupuncturists because of that. Of that law, those rules in each state. So Something I would really love to learn myself if I could legally perform it. Oh, there we go. Nice release in that shoulder. Excellent. Stretch this leg out. Go. A lot of times when you stretch the legs like this, horses will lean away from your stretch, lean away from the side that you're stretching. And I think that's really because you're really opening up the chest, and they lean away, and it helps to stretch out those pec muscles. And you'll see them lean away, drop the head, take deep breaths. They really, really love their leg stretches. And I can take a horse that's not really working well with me and is really, afraid or in pain, just not willing to stand here. If they're not willing to stand while I'm adjusting, I can go to their front legs, stretch them out, usually calm them down enough to let me get in there and do what I need to do. But usually they just love their leg stretches. So really good thing to do for your horses if you have performance horses, or even if you just have horses you like to trail ride on, just to give them some comfort, help them stay nice and limber, protect against joint degeneration. Really good for neurological reasons as well. And if you want to learn how to do some of these stretches that you're seeing me do, my website, sporthorsechiropractic.com. Ooh, that fetlock is really locked up. You can go to sporthorsechiropractic.com. At the top, there's a link to my equine stretching course. And I teach you how to do 26 different stretches. There's over 90 minutes of content on there. And it's really, really beneficial for horses. So I'd highly recommend checking that out. Good girl. I'm going to check her back legs and then stretch her jaw, and then we'll wrap it up. Sorry, David, I don't understand Dawood. I don't know that language. Let's see. Have faith when your horse is sore and stiff both sides, when you know which to take your horse to, vet or chiropractor. Well, I mean, just personally, like in my personal life, for myself, for my family, and for my animals, whenever I have a soreness issue, my first stop is the chiropractor, because if I go to the doctor, I'm going to get pharmaceuticals, right? I'm just going to get drugs to cover up the symptoms, and it's the same for animals. And I want to cover the symptoms. I want to try to get to the cause. So if the cause is a joint that's not moving properly or pain in the muscles, I'd rather stretch those muscles, adjust that joint, get that area that's not moving right to start moving right, and help the body be able to move better, and therefore flush that inflammation out, get out old nutrients, bring in some new. Movement is key. So, anytime there's a pain issue, I would recommend, getting the chiropractor out there first. But, if it's something like a lameness issue, they can't put weight on a foot, it's something more severe than just typical pain, then absolutely call the vet and get them out there. Sometimes I'll see things when I go out and I'm like, yeah, this isn't a chiropractic issue. Or even if it is, if the pain that the horse is experiencing is more than mild, then, I'd rather have the vet come out, check it out, make sure there's nothing more severe going on, just for the horses. Oh, thanks, David. I appreciate that. Elaine needs a chiropractor. For animals or for yourself? Gouda. Before I went to a chiro, X-ray showed my back was 9 degrees out, and my hips were around 3 degrees. Yeah, that's amazing. Yeah, I think the main issue with chiropractic in general is most people think it's for pain and symptom relief, right? We always think of back pain, neck pain, headaches, and if you don't have those, then you don't need to get adjusted. But really, we're specialists in structure, and we focus on the nervous system. So, if your body's not moving properly because your joints are locked up, you're going to have a lot of problems from that, from muscle soreness to joint soreness, joint degeneration, disc problems. There's a lot of things, but we also don't function as well if we have issues like that either, because as we all know, like, movement is key to life. And if you're locked up, can't move properly, your life's going to be degraded to a certain extent, even if there's no pain involved. So, adjustment is just for wellness, getting you feeling good, getting your body moving right, and it really does improve your life. Yeah, exactly. Sitting at a desk, it's so terrible. And the crazy thing is, sitting at a desk, if you think about your seated position, your hips are flexed the entire time. And if your hips are flexed the entire time, the muscles that extend your legs, right? So if you're seated, your legs are in this position, and that stretches everything in the low back, in the glutes, hamstrings. And if those things are stretched, those are the muscles that are responsible for extending the legs behind. And so you're sitting for a long time and you get up, and the muscles that are responsible for pulling your legs back and extension are not firing properly. That results in all kinds of low back pain, improper locomotion of the lower legs. You get knee pain, hip pain, back pain. Your neck starts to hurt. It just works its way up, which is why it's so important when you get up from a seated position to do a little, do a little bit of stretching. It kind of sounds ridiculous, but if you're in a place where you can get up and walk backwards before you start moving forwards, that'll get that firing order, that firing pattern in the lower legs, or in the legs in general, to get reset and fire properly before you walk forward. If you walk forward and those glutes aren't firing, then you're going to overwork your hamstrings. This pulls on the pelvis, causes low back pain, all kinds of weird stuff. So just try to get up and move around as much as you can. Yeah, there you go. Serious tight hamstring, that's caused by a serious lack of contraction of the glute muscles. So, do some exercises that extend the legs, walk backwards for 30 seconds to a minute when you get out of bed in the morning. Anything you can do to fire those glutes is going to really, really help those hamstrings relax, and get your extensor muscles for your leg firing properly. It's really going to help your low back and hamstrings. All right, I'm going to check her back legs. Oh, I want you guys to be able to see this part. So, good girl. All right, let's see. Good girl. Oh, good girl. Good girl. Whew, there we go. Really nice release in that hip. Let me know if you guys could hear that one. Sometimes they're hard to hear, but that was really nice release in that hip. I'm not moving forward today. You're going to have to make me do that. There we go. Come on, over. Come on, over. Get. Good girl. There we go. Good girl. Oh, good girl. All right, let's get this right hind taken care of. Oh, hey. You just wanted to get a bite of her food. Come on. Oh, girl. Ho. All right. Let's see. I can't see you like that, Goofy. Come on. There we go. Good girl. Good girl. All right. Whoa. All right. Oh, there we go. Little release in that cycle. Sorry, I couldn't see that one, but she was more interested in getting a bite of her food. Awesome. Thank you guys for watching. Hope you guys enjoyed that. If you don't mind hitting like, and if you want to subscribe for, notifications of further lives or to see new posts on my channel, I'd greatly appreciate it. Again, if you want to learn how to stretch your horses, go to sporthorsechiropractic.com and click on my equine stretching course. And I hope you guys have a wonderful day. Thank you. Have a wonderful one. Goodbye.